Hello and welcome to #OurDocTalk. This is NorthBay Healthcare's way to reach out to the community and answer questions on important health issues. I'm social media and online specialist Robin Miller, and today we're talking about hands, and with me is Dr. Daniel Birkbeck. He is an orthopedic surgeon with a special interest in hands and wrist issues. He earned his medical degree from the University of Michigan Medical School. Thank you for being here today. Also with him is Lori Russell. She's an occupational therapist and a certified hand therapist with NorthBay Healthcare. Thank you both for taking time out of your busy schedule to do this. I appreciate it. For some reason, my camera's making me be vertical, so we're just going to switch back and forth between you as we do this chat. I do have one piece of advice for those of you who type in your questions. Just protect your personal health information. Instead of writing in first person, ask your question in third person. What if a person has this instead of I have? And with that, we're just going to jump right into our topic. What are some of the most common hand and wrist problems that you see and treat?
Well, of course, everyone thinks of carpal tunnel syndrome, which is a nerve problem of the hand. Carpal tunnel syndrome is where your hands will tend to fall asleep on you doing routine daily activities, driving. Oftentimes you wake up in the middle of the night because your hands are asleep. They can ache, and really many different symptoms go along with carpal tunnel syndrome, but that's probably one of the more common things that we see in the office. Other things involve also waking up with your fingers basically stuck down. It's called a trigger finger. Lots of those. And of course the traumas that we'll get on a daily basis. If you are unfortunate enough to catch your finger in a leash of a pet or something of that nature, it can break fingers and fall and break your wrist. And so those are probably some of the most common things that I see.
Okay. I had a friend who had a ganglion cyst. Can you explain what that is and what causes it?
A ganglion is a fancy name for a sac of fluid that can come out of any joint in the body. The wrist is probably the most common area to develop a ganglion cyst, either on the palmar side or the back side of the wrist. However, a ganglion can show up in other areas of the fingers as well. They're called different things in different parts of the hand. It's called a mucocyst, and when it's found out towards the fingernail, it can be called a retinacular cyst. When it's found on the palm, it can be a regular ganglion cyst when it's found on the wrist itself. So any joint is mentioned in the body, including your knee or your ankle, can develop a ganglion cyst.
Is it always something that you have to do a surgery on? Or
No, you don't have to ever. Actually, I try to talk people out of it because one of the biggest problems with surgery is recurrence. They can come back. Probably even with a well-done surgery, about 1 in 6 people will get the cyst back. So usually the surgery is only if it really is bothersome or really unsightly or causing other problems. But typically, they're completely harmless.
What causes them?
No one really knows. It can be a trauma-related incident, but we also get them in 9 and 10-year-old children with no history of arthritis or trauma. It can be an arthritic condition as well.
Okay. And I assume you see a lot of hand issues with arthritis as well?
We do. Yeah, we certainly do. We have the full spectrum, slightly different than a hip or a knee as far as treatment, but slightly modified. But we have ways of splinting, treating them without surgery, of course, and then there are surgeries for depending on which part of the body is bothering you.
How do you know if it's arthritis versus you just overdid something or injured yourself? Or
Good question. I think that if you have a history of previous injury that 20, 30 years ago, and hey, that joint's starting to bother you, weather changes tend to bring it along, stiffness, pain related to the certain joint, swelling, those are good signs of arthritis.
So we have, thank you, Freddie, for asking a question. I appreciate it. Let's see, it says see more. Let's see if I can see. I don't want to mess it up. Let me do it on my computer. Freddie says, I have a question regarding someone I know that's a patient. And I'm sorry, it's going to take me a minute to open this up on my laptop, people. We are not fancy dancy here. It's laptop and iPhone, so give me just a second. Okay. He says, What happens if one hand is longer than the other? Does that have anything to do with cerebral palsy? And I'm assuming you're talking about like the length of from fingertip to wrist.
Yeah, that's an interesting question. Bones will tend to grow depending on the forces applied to them. So yes, if an arm or hand isn't used as much as the other side from something such as cerebral palsy or paralysis of some form, the bone won't develop quite as similar as the other side. So yes, it would definitely make sense that someone with cerebral palsy or some other form of developmental arrest during the growth period would cause that limb to be shorter. So that would certainly make sense.
So you talked about how carpal tunnel is one of the things you see a lot and deal with. What is there something that people do that puts them at greater risk for carpal tunnel, and how do you diagnose carpal tunnel?
Yeah, I think that's one of the misconceptions, that you have to work at a keyboard or do some form of repetitive activity to develop carpal tunnel. And I would say the opposite. I think anyone can develop carpal tunnel syndrome. I think some people are perhaps more prone to it. Some of it can be your anatomy and predisposing factors. But I think it's pretty fair game for just about anyone to develop. It's not always the dominant side either that can develop carpal tunnel. And what I would say
Diagnosis.
Diagnosis. A lot of it is the history and the physical examination. Once that is established, typically we'll get what's called a nerve conduction study, which is a special test where electricity is run through the nerve, very small amounts, but electricity is run through the nerve to determine how fast the signal travels across what's called the carpal tunnel, which is the area of the wrist where the compression typically occurs. Depending on the results of that, it's more of a confirmatory aspect of the diagnosis.
And treatment options, you said not to, you try to talk, I mean, is it always surgery?
No, definitely not. Usually what we'll do is try activity modifications. Lori next to me can talk a little bit also about various stretches and what's called nerve gliding exercises, things like that. And then, of course, wearing a splint at night is oftentimes very helpful. And the splint will put your wrist in a more comfortable position so the nerve doesn't get pressure on it. And then a little more advanced treatment might involve some steroid injections to try to get the inflammation down around the nerve. And then, of course, the surgery, if that's the last resort.
Okay, so Lori, your turn. Let's talk about some of those types of exercises and stretches that you have someone with carpal tunnel do typically.
Well, you're trying to get the pressure off the nerve, because when you put the pressure on the nerve, you're getting all the numbness. So we want to kind of get things moving in there, and we kind of call it like your rotor-rooter job. You're trying to unclog that tunnel there. So we do tendon glides. You got 9 tendons that make your fingers flex like this. So we want to get the pressure off the nerve. So we do tendon glides with them. We have a really special one we like to do. It's we give them this little pencil with this little foam, so they're not gripping this too tight, because this can put pressure.
Mm-hmm.
And we just have them do their glides through here, and you can kind of see the movement in the wrist there, going back and forth, nice and easy. You want everything easy. And then we also do some glides for the nerve, which are some very easy movements. Nothing is like, stressful. You want to take the stress off. You don't want to add the stress. And we do some very easy glides to move the nerve and kind of floss it through that tunnel and get the pressure off of it.
About how long is a typical person going to have go through therapy, or do they have to come here to do it? Those seems like exercises and things you can do on your own.
No, and that is what we try. We educate, because basically it's what they're doing out there that's gonna help.
Okay.
And we do lots of patient education on body mechanics and postures, and doing this a lot all day long is like the nerve can't go anywhere but right here, stops right here. So we do lots of education on maintaining neutral postures, building up your grips to take pressure off, doing your exercises, because coming to therapy once or twice a week isn't going to do it. You got to do it at home. You got to follow through. And yeah, you're not going to go to therapy for 6 months to get rid of it. It's going to be what you're doing on your own.
And Dr. Birkbeck mentioned splints.
Yeah.
You do splints?
Yeah.
You
we
kind of make your splints,
yeah,
don't
we
you?
do. We do. We have this plastic material, and we'll make a splint. And for a carpal tunnel splint, it's just like a platform. We call it a wrist cock-up splint. And it's just basically to keep that tunnel open. You don't want it bent like this. I kind of use the analogy, think of your arm as a hose, and you bend that hose, the water's not going to come out, right? So you bring it up like that, and it's going to shoot out. But we use this thermoplastic, and we custom make them.
So you'll fit it right to the patient.
Fit it right to them, yeah. We do lots of that.
Okay, great.
And they can wash them.
Okay. Tendonitis. Is this something that happens a lot in the hands as well? And what does that mean, tendonitis?
Absolutely, yeah. Tendonitis, it depends on where in the hand it is. There are certain areas that are more common than others. One of them I mentioned a little bit earlier, called the trigger finger, is a form of a tendonitis. And basically wherever you have a tendon gliding through a tunnel is...
and there's lots of that in your hand,
lots of that in your hand, lots of tunnels. The bottom palmar part of the hand has tunnels throughout the fingers and in the thumb. The back part of the wrist has 6 different tunnels. Probably the most common one is the first one over here. It's called de Quervain's tendonitis. And again, you'll see a common thread with our treatment of this. We'll try to get rid of the offending activity first. Try things that Lori was describing, like splinting, which is rest, different exercises and different things that she can expound on a little bit later as well, with the ability of using ultrasound and things to get tendons to settle down. Steroids, if it gets steroid injection, if it gets severe enough. Usually by the time you're coming in to see me, you're probably to the level where you've tried splints and you've talked to your doctor, and hey, you need to go see the hand surgeon. So oftentimes when someone comes in to see me, we'll try a steroid injection, and they're pretty darn good at getting a cure. I'd say 80-90% of the time, the tendonitis, if it's a trigger finger or de Quervain's, will go away. Probably 20% of those will recur, so you may be coming back to see me again, but it's worth a try. But it's hopefully a curative thing and not just covering it up. Whereas steroid and some things like arthritis are typically more so for just hiding the problem. You're not actually curing it. But with tendonitis, they tend to do reasonably well with steroid injections.
And I assume that people are coming to you with these problems because they're feeling pain in their hands. And you described with trigger finger, you wake up and your fingers are pointing down. That's a different kind of symptom than just my pain.
They usually hurt as well, so it's both.
Okay.
Yeah, it's both.
What does arthritis feel like compared to tendonitis? So if I'm at home and I'm having pain in my hand, how do I know if it's arthritis or just tendonitis?
That's a good question. It's hard to tell sometimes, even for us. It can be difficult to tell because they can be right next to each other. Arthritis usually is involved more with swelling and a joint, whereas a tendonitis may not be right over a joint, but they can be right next to each other. It can be a little difficult to tell.
Can you have both at the same time?
Absolutely,
going on?
you sure
great.
can. Yeah.
Are your patients typically older when they're experiencing this, or can you see this?
You see it all ages, the tendonitis especially.
Okay. And so at what point does the hand therapist typically come into this process?
You know, I just want to say, first of all, we're really lucky to have Lori. There's, I think, 3 or 4. She's got a special designation. That little C stands for certified, and they're very rare. So we're lucky to have her in the NorthBay system. There's, as I say, I think only 3 in the whole NorthBay area. Sometimes 4. There's kind of a part-time one, but to get someone like Lori is very unusual, and we're lucky to have her around here with her expertise. And so, you know, usually you need a referral to get in to see her. So any of your primary doctors could do that. I certainly do it all the time. And, you know, hand therapy, much more so than physical therapy, say after a total knee or what have you, is critical, usually for both non-operative, meaning if you just have a tendonitis like you're speaking of, or even doing a surgery. A lot of the hand surgery is very critical and I'm a big believer in hand therapists, so they really do a wonderful job.
Okay. So tell us about that certification process.
Don't be modest.
You
worked
had
hard
to be
to
an
get
occupational therapist first, right?
Yes,
for
I
a
had
long
to
time.
go through schooling and get my degree, and then do a 6-month unpaid internship,
Wow.
and then take state boards, and then be an occupational therapist. And I had to get a job and had to work and get some hours under my belt, and then I had to find a certified hand therapist and work with them. And I was fortunate early on here at NorthBay, and we had some relationships with some of the hospitals in San Francisco, so I got to go and work with some hand therapists at Davies and some of those hospitals over there. And you got to get something like 4,000 hours under your belt before you could even sit for the exam.
Wow.
for hand therapy.
All
Then you
right.
got to pay for that. And
Yeah, it's a big deal.
it's a lot, and it's even a longer process now
Wow.
than
Yeah.
when I did mine.
So you're a star.
So.
That's what you are. So I see you have a bucket of goodies
I
there.
have a
Let's
bucket
talk
of
about some of the
goodies.
things that you have in there and how you use them in therapy.
Yeah, well, therapy, that's a huge thing with therapists. We use lots of therapy, and it comes in all different colors, and the different colors means it's different resistances. And we'll use this just for working, once we get to the level we're working with some strengthening and some fine motor activities, and you can
It's like
really
silly putty.
manipulate this. It is like
Little-
silly putty.
A little thicker though.
Yeah, I think it lasts a little bit longer too. But it does bounce. So, it does bounce. And it
That's
does
fun.
pick up cartoons if you press
Yeah.
it. It's cartoon like the silicone used to. But
So
we'll
you're
use
basically
this.
having them squeeze and manipulate it.
Yeah,
and-
have them squeeze and manipulate it, roll it. I use this for stretching your extensors. They're doing some lawn work.
I'm doing some lawn work outside. Sorry
I-
for the sound there.
I use a lot of household gadgets, stuff people have at home. This is one of my favorite ones, and it's always a topic of conversation in our clinic because it is a toilet paper roll, and we'll use it for working on some flexion
Okay.
for your thumb, and
Is that flexing your thumb that when like you have arthritis or something? It almost seems like you don't want them to do that.
well, you don't want somebody to not flex and bend
Mhm.
because then they'll just be stiff and they'll have a non-functional hand. So
Oh, okay.
you do want to, and we try to find things, you want to keep things more, less aggressive, less resistant.
Right. So easier, not harder
That's
to
right.
push, but easier
That's right.
to push.
And
yeah.
you find ways to modify things. We use a lot of this stuff to build up grips.
It's foam.
We use this on walkers and canes and
It
knives.
looks like the stuff you put on your hoses when it's
It
cold
is.
outside. It's the
It
same
is.
thing.
I went to
Okay.
Home Depot and got a long roll of it. We use
Okay.
this. I just put it on my mom's walker
Yeah.
hands. She had a total knee. So we use a lot of this, and we practice different ways of cutting and using your forks. We do a lot of self-care. I mean, everybody's got to eat, everybody's got to dress, and that kind of stuff. We make some of our own stuff, We have somebody who's had a thumb surgery for their arthritis in their thumb, and we just want to do a little bit of stretching here.
Oh, okay.
So we come up with these little gadgets and we make them out of our splinting material, all the scraps.
Okay.
And we're crafty people.
Yes. So what is this big yellow thing you have?
I use this a lot. I love this. It comes in different colors, again, and different resistances. And I'll use it when I'm trying to get some wrist extension. So
Mhm.
somebody who's broke their wrist and we're working on getting this back, or working on some weight bearing without a lot of resistance yet. And
Okay.
I have them push
So
into
it's kind
that.
of stretchy and rubbery.
Yeah, it is stretchy and rubbery, and you can actually do a lot more things, but I like it to stretch out all this area here. And you can do all kinds of different things with it. Some strengthening here, some twisting to work
Uh-huh.
on this, all kinds of different things.
Fascinating stuff.
It is.
Yeah.
We have all kinds of toys.
How often would typically would a patient come to work with a hand therapist? Would that depend on you as the doctor saying, I want you to see her however many days a week or?
Yeah, probably 2 or 3
Yeah.
times a week,
Yeah.
depending what it is or
It just, it depends, and it
what the
depends
injury
on
is. Yeah.
on how much the patient's able to do, and their family support is certainly a factor also.
Okay.
But at least a couple times a week, and then we'll wean down to once. Sometimes I'll go every other week. It just depends.
Are there things that, or exercises or actions that people can take to avoid a hand injury? What can we do differently than what we're...
Well, I'll just say, I'll start by saying pumpkin time is coming up, so be careful of pumpkin carving.
Nice.
Every year I get 2 or 3 pumpkin injuries,
Oh, yeah.
and they're devastating because it's just a teeny little poke from that sharp little knife, but it's enough to take out your tendons. Usually it's a small finger too. Or avocado, just be careful when you're pitting an avocado. Never do this, because oftentimes you just jab in and that's all it takes to cut your tendons. And then you have to go see Lori for months and months and months after your surgery. So things to prevent are really important, like the pumpkin. Get the dull with the dull serrated knives with the dull tip on them, just so you can't let your
I think
kids
they
hurt
sell
their
those
hands.
in every...
They certainly
They're
do.
everywhere
Those,
now.
Target,
Yeah.
Walmart,
every
whatever,
year we
yeah.
get the same injuries, and it's really frustrating
Yeah.
to see because it's hard to recover from.
Right.
And then the avocado pitting is difficult too. So just don't be shoving the knife towards your hand.
Okay.
So those are important. Things
And
like
what
that.
about like regular exercise? We always think about exercising, treadmill and stuff to
Yeah.
get ourselves physically fit.
Right.
Is there things we can do to make our hands more fit?
Just, with some of all the jobs out there, just, regular stretching, our muscles and our tendons in our hands, they need to be stretched just as much as our biceps and our triceps. And just, making that a routine to stretch when you're sitting in one position for a long, and taking your breaks properly.
Right.
It's that repetitiveness and changing things up a little bit.
I had somebody suggest a tennis ball, rolling a tennis ball between your hands, and you can also use it to
on your back,
on your back and stuff.
Get
So.
some trigger points.
The stores and online, you can order those. I don't know what they're called. They're grippy things that you squeeze, and they're metal at the top, and they have handles, and you squeeze them.
Grippers.
Do those really work? Are those really worth? Because some of them seem like they squeeze really hard.
They do, and you have to be careful with them because some of them can be really hard, and you can actually injure yourself using them.
Yeah.
And if you use them too often, if you use them too much, or you sit there for an hour while you're watching your favorite show and forget your gripping,
Yeah.
then you're just giving yourself another tendonitis,
Right.
Or something.
Okay. And just one last thing here, because we're almost out of time, but in general, what advice would you give to people if they're feeling something discomfort in their hand, or what should they do? When do they know it's time to go see a doctor?
I would say time. If you know that you've just worked out in the yard for 10 straight hours and that hurts for a couple days, if it doesn't go away, I think is the biggest thing. Every time you get a pain in your hand, you don't need to be jumping to see the doctor. But if there's something new and it just really lingers on, that I think just give it a little time and then maybe go on in. But if it's an acute injury, you definitely had something happen to you, you've fallen and you have swelling and it's not getting better. Don't ignore it. Get it checked out. Get an X-ray, most likely. Those are probably the biggies. Don't ignore the injuries, probably.
Right.
Yeah.
Okay, well, we are now at the 1 o'clock hour, so I'm going to say thank you for taking time out of your schedule to do this. This post will live on Facebook, and
Forever.
Forever. People will be able to watch you forever. And then I will also post it on YouTube. So thank you for
wonderful.
tuning in.
Perfect.
And have a great day.
Perfect.